So welcome back. Now the word cancer, it actually comes from Greek, meaning crab, and it is a disease that has been around for quite a while. We do know that the ancient Egyptians described it around 1600 BC, and they first described breast cancer. Cancer is very, very common. There are about 20 million new cases per year worldwide, and it can be a major cause of death. Now, what is cancer? So, normally in our body, the cells, remember those are the smallest parts of our body, they grow up, they do their job, they divide, they make copies of themselves, and then they die out if they get too old or get damaged. And then the body will recycle or reuse whatever it can. However, cancer cells don't have that self-destruction mechanism, and they will keep dividing, so they become known as rapidly dividing cells. And when they are rapidly dividing like that, they need more energy, so they will steal the blood and the food from the cells around them and starve them out. Now, before we go into more detail about cancers, you have to know about three basic ideas. The first is a tumor. Now, a tumor just means a growth, so it can be an abnormal growth of any type of cell in the body. Some tumors are benign, which means they're not dangerous, but some tumors are malignant, which means they are cancerous. The second thing to know about are precancerous cells. So these are cells that have started to change kind of halfway, but haven't made it to the cancer stage yet. And this happens because remember, our body is always adapting. So take, for example, if somebody has a lot of GERD, and so now that acid is going up and down the esophagus where it shouldn't be. And in these cases, the cells that line the esophagus, they will change to adapt to the high acid level, but then they can become precancerous, and if left alone, they can become cancer as a result. The third thing is metastases. So metastases, or METs, is basically when the cancer starts to spread to different parts of the body. Now, there are two types of cancers. There are the solid tumors and the liquid leukemias. The solid tumors are basically cancer cells that will grow and grow in one place, and they will start to push on other things around them. The liquid leukemias are cancers of cells that are kind of already in the blood system, and they will kind of float through the blood to different parts of the body, like the B cells and T cells. And then there are some cancers that can act a little bit of both areas. So one example is the lymphoma. Now the lymphoma, if you remember, the heart pumps the blood through the arteries to different parts of the body, and it comes back to the heart through the veins. But about 10% of that blood gets filtered through the lymph nodes. And the lymph nodes are little balls of tissue on the inside that are normal, and they're always monitoring the blood for anything dangerous. When these lymph nodes get cancer, they can grow and grow in one place, so they can look like a tumor, or some of the B cells or T cells that are now abnormal can now go through the blood, and they can act like a leukemia. Now, the symptoms of cancer really depends on where it is. So, for example, sometimes, not all the time, but sometimes colon cancer can give bleeding when going to the bathroom. Breast cancer can give a lump. Skin cancer can give a change in the color or the lesion itself. However, the more common symptoms of cancer are extreme tiredness and losing weight for no reason. And if you think about it, the body is so busy trying to deal with this cancer on the inside that it doesn't have time to maintain things that would normally happen, such as maintaining weight, maintaining blood levels, etc. And these patients will describe that they're very tired, they're almost bone tired, and some patients can even get low-grade fevers. As far as the risk factors for cancer goes, the biggest risk factor is tobacco. And in fact, if you look at worldwide cases of cancer, almost 1 out of 5 cancer deaths, sometimes even more, are relatable to tobacco. But there's also alcoholism, obesity. It can run in families, like genetics, hormones, certain infections, certain exposures like radiation, etc. Now, the diagnosis of cancer really depends on listening to the patient, what symptoms they're having, matching it up with what is on their body, and then doing labs and tests and scans accordingly. And I will sometimes get a patient in clinic, and you know who you are. They have a scan done, maybe a chest x-ray, and an abnormal something was seen on it. So they are called to come back in 3 months and to reevaluate. Now the patient, rightly so, is very scared that this cancer is there, is growing, it's spreading, and they are very nervous waiting for those few months. However, the cancer in that state is kind of like a weed that is coming up in the garden. And when a weed first grows, if you keep picking at it, it'll just come back. So you kind of have to wait for the weed to grow a little bit before you can pull it out by its root. So it's the same thing. You need to look at the cancer when it's a little bit bigger so you can get better information out of it. As far as the treatment of cancer, probably the best way to treat cancer is to prevent it in the first place. So again, avoiding those risk factors, avoiding the tobacco if at all possible. And now there are certain screenings for some cancers out there, such as breast cancer and colon cancer, cervical cancer, etc. As far as treatment otherwise for cancer, they fall in 2 or 3 different groups. So the first group are treatments that will attack those rapidly dividing cells. So they will block something very important or very essential for that cancer cell to keep dividing. And in that case, what happens in the cancer cell will die and the body will do its thing. Examples of this would be like your radiation treatments, chemotherapy, targeted therapies, etc. There is another group of treatments that will make it so that the cancer cell can be seen by the body's immune system more easily. Remember how we learned when a cell becomes abnormal, sometimes it will send up a flag, kind of a flag for the immune system that's whizzing by to take a look and see that there's something is wrong and then take care of it. Well, in these cases, what happens is the cancer will not let the cell put up that flag. And so some of these medications, they will go in and they will force that cell to put up a flag, and now the immune system can go in and clean it out like it's supposed to. Now, because these two groups of treatments are targeting rapidly dividing cells, they will by default attack some things in our body that are rapidly dividing anyway, such as the lining of the mouth, the lining of the gut, the hair, the skin, which explains some of the side effects that cancer patients may get while pursuing treatment. Surgery is always an option too, and then sometimes palliative treatment. Now, palliative treatment just means that the body is being supported while it's undergoing these cancer treatments in general. The prognosis of cancer is much better today than it was even just a few decades ago, and it really depends on the type of cancer and how much it has spread, so before it has metastasized, so how early it's caught. And I often get patients in clinic that are very afraid to pursue a treatment for cancer because of something they have heard or something they have read. Again, you know who you are. And I tell these patients that, look, every human body is unique. So how every human body reacts to a disease, how it responds to treatment will be a little bit different. So it's a very, very important for each patient to gather good information and choose what is best for them. As Superman said, there's always a way. Until next time.